All right, welcome back to the Dental Domination podcast. This is episode 8, believe it or not, and I am Dan Bryan. I am the co-founder of DentalScapes. We're an online marketing agency specifically for dental practices, serving general dentists, pediatric dentists, orthodontists, you name it, specialists of all kinds. But I'm really excited to bring back someone who has been on the show previously to actually discuss spa dentistry on that episode 6. Check it out if you haven't already. But I'm here joined today by Jessica Martin, and Jessica Martin is the founder and CEO rather of Martin Management. She does consulting with dental practices, other healthcare practices as well. She's also the co-owner of Martin Dental Spa in Wisconsin, where her husband is the managing dentist there as well. So, Jessica, thank you so much for coming back. And today, this is a topic that was sparked in part by our previous conversation. We're going to talk a little bit about going out of network and how dentists can manage that transition. And it's a transition that you and your husband recently completed, or at least started the process back at the end of last year and have since completed. And so I'm really looking forward to this conversation, getting your take on what's all involved, what you would recommend, what maybe you wouldn't recommend, and just getting your tips and tricks for how to do this, because it's a process, and as you said offline, it's an emotional one too. So I want to talk a little bit more about that. But welcome back to the show, and if you don't mind, just take a few moments to let folks know who you are and where you're coming from, and what's Martin Management all about?
Yeah, thanks, Dan. It's great to be back. I feel like I know you very well already, so it's an easy conversation to have. So what I do with Martin Management, none of it was by plan. It was all just organic, how it happened, which I think some of the best things can happen that way. I got sucked into my husband's practice back in 2014. And I say sucked in.
That's never happened before.
I know, right? I kind of went kicking and screaming, but it was all for the best. And it was really interesting to see how my background as a school psychologist really blended well to the dental environment and really being able to help the practice grow and differentiate in a different way. So along that journey of working in the practice with my husband for the last 9 or so years, we kept moving in this direction of getting out of network, and that was always, I think, in the back of his mind as like a dream that would be, ideal to not have to take all of these write-offs and adjustments. But it was one that we weren't sure we would be able to attain, to be quite honest. I think every dentist, private practice dentist really has those hopes, but it sometimes feels like a really big leap. And so when we did do with that, I wanted to be able to share, what worked and what didn't, because we felt, I don't want to say we were nervous, but for sure we were nervous at times, but we didn't have like a blueprint for doing so. And it would have been nice to have someone that had done it and lived it to have as the guide for that process. So that's what I've been doing for a lot of practices. It's kind of hitting the nation in a great way right now. And I think that's good for everyone to get,
it's cool.
To get more
it's cool. And I wanted to hit rewind real quick because, you mentioned that this is something that obviously a lot of dentists would like to do or have contemplated doing. But, whether or not that actually happens is a whole nother matter. But what was it, if you can think back, you and your husband having conversations at the dinner table, like what was it that actually prompted you to say, all right, we've thought about this for a long time. We're actually going to, press play and make it happen. Like what was that like, and what prompted you to actually decide to move forward with this? Was there a tipping point?
I think we've been talking about it for a number of years. I would say 4 years before we made the decision to do so. And every year, I think it was just looking at that year end and going, wow, look at all of these adjustments that we made and all of this production that we're giving away essentially. And my husband has always been very steadfast in that he wants to do quality dentistry, that he wants to give people the care that he would want for me and for our kids and for his extended family. And so it just came to a point that in order to do that any longer, we had to make this decision. And, it helped that we were at a point where we had a lot of demand built up. We had long waiting lists. We had a lot of loyal patients. We have a differentiating factor that makes it harder for people to just go down the road and get the same experience. So we kind of had lined up all of these things over the years, and there was really nothing left to do, in that arena. We were like, gosh, if there's ever a time to do it, the time felt like now. It just felt right, given all the building blocks that we had made up to that point.
Yeah.
I think it was just looking at that number again and continuing to see it climb. He just came home one day and he's like, I
Yep.
can't do this anymore.
Yeah. Yeah. Well, that really resonates with me. And I think it does with a lot of other practice owners and dentists such as yourself and your husband. I mean, the passion for dentistry and wanting to provide the best possible service to one's patients. I mean, that should always be the goal. And sometimes, payment arrangements, reimbursement makes it difficult. And so I think that's a motivation for a lot of dentists out there. And a lot of dentists are at least thinking about, making a change like this. So you decided to move forward, though, with going out of network. What did that look like practically for you? What were the first steps that you had to take? And what did you sort of do to prepare your practice and really prepare your patients as well? What did that kind of look like in theory or in
Yeah,
practice, rather?
that's a great question. And that's part of why I do what I do now with training other teams, because he'd been talking about it for a long time. But when he finally made the decision, I want to say it was mid June, is in the summer. He was finally like, nope, we're doing it. And I was like, okay, so what does that look like? When are we going to start talking to patients about it? And he's like, I want a letter to go out July 1. And I was like, wait, what? So there was not a lot of
Yeah.
time. And it didn't happen that quickly because we didn't have our ducks in a row. So, I think some intentional, careful thought on the planning and when it's going to happen it's helpful. So it lowers the stress level for everybody. But the first steps are really deciding what that timeline is. And if an office can pair it with the timing of the drop being final around the time of an open enrollment window, that can be
Hmm.
really, really helpful, because that gives patients the opportunity to decide not to renew their insurance if they're an individual policy holder. They might be able to talk with their HR department if they work for a big employer and be able to switch a plan, or
Yeah.
not have a plan. If they drop February, of the next year, then the
Yeah.
patient might not have the time to make those decisions. And now
Yeah.
they're stuck paying a premium every month that they might not be utilizing if they stay with that office. So the timing is really the first step in making, really intentional thought on how to go about doing it. And then once we have a timeline, then we can, backtrack and say, okay, now here's how we're going to start talking to patients about it. Because
Absolutely.
really, like, the biggest piece of this is educating patients on what this means for
Absolutely.
them, and getting the team to feel really comfortable and confident to have those conversations.
And so, to that point, communicating the change and also educating patients on what it means and what it means for them specifically and their families. How did you decide to do that? So, it sounds like, at least initially, you had intended to send a letter. Did you do that? And then, what other communications channels did you leverage? Did you use email? Did you use text messaging? I mean, how did you do that? And how did you? Well, I'm going to start there because I have a bad habit of packing like five questions into one. So, we'll just stop there.
Yeah,
What
yeah,
was the
that's
first
good.
step?
No, the first step was to send out a letter. We sent
Okay.
it via snail mail. Made our mistake there because, again, he wanted it done like so promptly. And the other funny thing
Yeah.
was he only wanted me, because I am like a perfect human that makes no mistake. He only wanted me to touch every letter. So I literally like holed myself up in our basement, and I had a template, but still I had to make sure every family's name was spelled correctly. And I went through, and I didn't trust the software. I just kind of
Yeah.
hand touched every single letter that we did, which
Yeah.
obviously was awful for me as a person to do that. But we didn't
I'm
have ink,
sorry.
we didn't have envelopes, like the right stuff. We weren't prepared because it happened so quickly. But
Yeah.
yeah, that was our first step. We did not use email. We did not use texting, but we did, because we started the conversation early. We
Yeah.
were able to hit a lot of patients as they did come in for care,
Yeah.
and be able to have those conversations, with them in person as well, which was helpful.
That makes sense. Now, when you think about the content of the letter that you sent out, I'm just curious because this is such a complicated issue and it's sometimes hard to distill it into one easy to understand message. What was sort of the prevailing theme of that letter? I mean, how did you explain to patients this decision to go out of network, and, um, you know, how did you frame the why, so to speak?
Right. Well, we definitely kept it about them. We said,
Yeah.
this is why we're doing this, is because we have a standard of care that we believe you should have. And
Yeah.
because of the reimbursement situation, we feel unable to provide that care in continuing this insurance relationship. And so
Yeah.
we really kept it focused on that this is kind of for them to a degree, that we, in order to continue to provide the care that we know to be the best, this is the decision we need to make. And to second that, we're here, our team is here and ready to help you figure out what this means. Because that's
Yeah.
the next, they're like, okay, great. I'm glad you're going to keep standards high. Nobody wants to get
Yeah.
chopped up dentistry, but
Yeah.
what does that mean? What does that mean dollars and cents wise for me as a patient? And so
Yeah.
it was really, crafted to emphasize that we're an advocate for you in this process. Like, we want to keep you. We want to make this a no-brainer decision for you to stay with the practice. We value you as a patient, and here's
Yeah.
how we're going to do that. Mm-hmm.
Okay, so and that all sounds great. I love the patient-centric, focus that you put to work there, in making it about them. And of course, it is about, standard of care, and it's being proud of the work that you do, and being willing and able to stand behind that. And I love that messaging. But so you send these letters out, and so let's say the post office takes 2, 3, 4 days. You're sitting there twiddling your thumbs. What was the reaction? What happened? I mean, what happened next? And what kind of response did you get from your patients, both patients that had been with you for years and those that were new? I mean, what was the reaction like?
Yeah, that's interesting. And it's been interesting also to watch clients I work with in this process to see how their patients react. And it seems like, by and large, there's a number of different ways it can go about happening. So the first thing
Yeah.
is the people that are, really Johnny on the spot, type A, they get the letter, they read it front to back. They're like, what
Yeah.
is this? And they pick up the phone and they're like, tell me what this means for me, right? They want to talk, they want to ask questions. They're on it. There's other
Yeah.
people that didn't either, let it sit on their counter for a while and maybe glanced at it, maybe read the first couple paragraphs and got bored and confused, and then waited till their next cleaning to ask the questions, right? And
Yep.
then there were people that either just don't open their mail, maybe didn't get the letter, or just never actually, really digested it, that still felt
Sure.
like they had no clue what was going on. So it was kind of like three chunks of people. And so
Yeah.
were the phones ringing off the hook? No, but we definitely fielded a lot of questions those
I'm
first few
sure.
months about, people wanting to know what that meant.
I'm sure. And how did you train your front desk, your reception team, like, to field those questions and answer those appropriately? What was that like?
Yeah, and so this is what we did, and this is what I teach other teams to do. And I think it's important to actually train the whole team
Yeah.
similarly, right? Because
Great point.
it's not going to just be the front office that fields those questions. The doctor's going to leave the room and the assistant's going to get asked, hey,
Yep.
so I heard you're going on network. What does that mean? And what do you think I should do? They're going to ask the hygienist. They're going to ask whoever's around. And if the team doesn't have a united, cohesive, confident answer to that, it doesn't feel
That's
like
so
we're in
smart.
control, right? So we trained
Yeah.
everyone on, we came up with a script that we as owners felt like embodied what we wanted to have said, and then we
Yeah.
encouraged our team to put it in their own words, right? I don't
Yeah.
like scripted anything really, but you need to have the foundation for your team to really memorize and understand, like, what are the basics of this, and then how am I going to articulate this as an individual and make it feel good for me to
Yeah.
explain. And so we had everybody, our team had scripts laying everywhere for quite a
Yeah.
while, just so that they could really, like, by osmosis, like, get it in their brain of what we wanted them to say and how we wanted them to handle it. And we talked about it a lot. We really, emphasized that it was important how we had those conversations, because we needed, when patients are feeling, just like with little kids, right? When patients are feeling like out of control or they're confused, if we show that we're in control and we're calm and we're confident about it, we help them to feel better. And so that's how we approached it from that training perspective.
I love that. I love the idea of, taking that team-based approach, and really that's what dentistry should be anyway, is team-based. But what actually happened then? So you got all these questions. You had folks in different lanes in terms of how they handled receiving the news and following up on it. But what actually happened then, if you don't mind sharing,
Mm-hmm.
in terms of retention among your current patients, and did you see any kind of volatility associated with this, or what did the transition look like from a business standpoint?
Yeah, that's great. So, it's been interesting also to see, to watch our practice deal with this and then watch other practices that I've worked with on this process. And I think the outcome on this really depends on a few different factors. The probably the one of the largest is the demographic that the practice is in. So if the office is the first in their community to make this move, it's a different outcome than if you're the last one to make this move,
Yeah.
right? And so when people have more options,
Interesting.
more choices, you're going to see a larger exodus. That's just by nature. People, they're not used to hearing that
Sure.
Delta's out of network. Like, that's just
Sure.
in a community where no one else has done it, that feels unheard of. And there's a
So
lot of
where did you fall on that spectrum? I mean, how
we
many
were the
other practices in your community? Oh, you were the first.
we were the first. Yep.
Oh,
Yeah.
brave new world.
I
Good
know.
for you.
I know it was
Yeah,
great, and I give my husband the credit for
that's
that.
pretty
He's the
scary.
risk taker. I was definitely more nervous than he was. He's the risk taker. He's like, we can't do it anymore. We're gonna do this. We're gonna power through it. We just had a team meeting last week, and we talked about we're still weathering the storm in that, right? Like,
Yeah.
it's gonna take probably a few years to really not have it feel a little bit different. But we've had a lot of amazing outcomes, even though we did see a large number of patients decide to explore different care. We have
Yeah.
actually seen our revenue increase by 3%.
Wow.
We've
That's
seen,
awesome.
obviously, our adjustments are down. I mean, our
Oh,
collections and our adjustments are down
yeah.
substantially. Even our AR is down. Our AR is like $30,000 less than it was, and we were
Hmm.
stuck at that AR level for years and years. We just always
Yeah.
had a certain chunk that we couldn't collect on, and it wasn't even insurance based. But because of the ways we've had to modify how we do business by being out of network with all insurance, it's just helped a lot of those things it's
Yeah.
cleaned up a lot of those things. So we're actually doing better as a business,
Amazing.
although it does at times it feels different because our schedule at times is lighter. Like, our hygiene
Yeah.
has more holes than it ever used to. We used to
Yeah.
be like just slammed with hygiene overflow, and now we have more holes. But that's okay because overall revenue's higher and actually
Yeah.
production's higher. So it's kind of like it's getting used to that new normal and knowing that, like, in the long run it's going to be amazing, but
Yeah.
we're still better off than we were a year ago already.
And to be clear, I mean, you went out of network, but you're still assisting patients in filing claims with their own insurance if they have it and that sort of thing. It doesn't mean that you're completely hands off.
Exactly. I think there's a huge distinction between, being completely fee for service and handing a patient a claim form and asking them to do all the work on it. That's a huger jump, right? Like, if you've been coddling patients with doing all their insurance stuff all these years, and then you decide, actually, we're only going to do cash pay and you're on your own. That's,
Yeah.
that's going to feel a lot different from the patient perspective. I really encourage offices, if you want to go in that direction completely over time, I think there's a way to get there, but being an advocate and doing a lot of that legwork still is a way to
Yeah.
retain more patients and make them feel more connected to you as an office than they do to their insurance company. And that's
Yeah.
obviously what we'd want anyway.
Yeah. I want to switch gears a little bit and talk about sort of the mental health component of this, because you said earlier when we were not yet recording, you said, I mean, this is an emotional thing for practice owners. This is in many ways, a scary transition, or can be. And that's especially true, I think, if you're like you and your husband were, in that you're kind of leading the pack in terms of the community and really being the first to not only do this, but the first to also explain it to patients and what it means and that sort of thing. And there's a lot of uncertainty in terms of how is this going to affect my bottom line? How is this going to affect patient retention? How am I going to go about generating new patient appointments, having to lead with this new message? So how did you manage that? I would imagine, how did you imagine that, or how did you manage that fear and anxiety? I mean, that's a real thing.
Yeah, I think we just kept reminding ourselves and our team, for that matter, that why we were doing this, right?
Yeah.
That in order to do what we needed to do to maintain our quality and our standards, we had to do this. And that we
Yeah.
knew, and just like we've done a lot of great things to build our business, but I can guarantee you that our practice, just like most others, there's levers to pull that we're not pulling, right? And so
Yeah.
we knew that if we really slowed down and we were hurting as a business, we could pull some marketing levers we weren't utilizing, right?
Yeah.
We could pull in other things that would help us to grow again. And so
Well, and that's where I'm going to refer listeners back to episode 6, because you've done a lot to really differentiate your
yeah,
practice as well, with the spa dentistry model and the amenities that you offer and that sort of thing. So, folks, go check it out. But I'm sorry, I didn't mean to interrupt.
oh no, you're fine. I mean, there definitely were stressful moments along the way, and there were patients that we saw leave that we were surprised by. We thought, oh my
Yeah.
gosh, like, we love that family. I can't
Mm,
believe they're going to go somewhere else. Like it felt personal at times
that's hard.
because
Yeah.
especially there were a couple cases. And that's the thing that patients don't understand is that for some people, there's going to be a big difference in what their out of network benefits are. That's a hard decision. If you get like no
Right.
coverage or really minimal
Yeah.
coverage, you're going to pay $200 for your maintenance visits. Like, I get it. I get
Yeah.
that you probably want to explore another opportunity. However, we had patients where it was like a $15 difference in their whole maintenance visit. And
Yeah.
they're like husband and wife physicians. And they're like, yeah, we're just that's too much for us. And I was like, really?
Mm,
And I'm not trying to judge anyone's
sure. Yeah.
situation. That's
Yeah.
not for me to
No,
do.
it just goes to show you never know.
You never know. So we were
Yeah.
surprised by some of those moves, and we were, disappointed by some of those. But, the other people that did stay on or that did change their policy to stay with us or said, I'm going to do whatever it takes, like that, we have to, like anything, continue to focus on the positives and,
Yeah.
and really hang on to those things and know we were
Yeah.
doing the right thing. We actually also had a lot of patients come back. We crafted I called it the farewell card, where we would handwrite every patient or family that decided to, explore another dental office due to Delta, because Delta was our last big one that we got rid of.
Sure.
That just said, we understand your situation, and we understand, we know that we valued having you as a patient, and know that should something change, we're always here, just so that it acknowledged that
That's
we
so
noticed
important.
they left, right? We
Yeah.
care, and we still want to be, here if something were to change. We want them to know that. And we had patients come back after getting that card. And so,
Yeah.
it's again a matter of time before it all cycles back. We've had a number of patients that have tried another dental office and called and been like, we got to come back. We got to make this work, because it just wasn't the same.
Yeah.
And that goes back to that differentiating factor of, we really have put a lot of things in place to care for our patients and give them a better experience. So
Yep.
that leap is a lot harder for them. And so
Yeah.
again, I think the more that an office can set themselves up to be different and to
Yeah.
do it better, if you will, the harder it's going to be for those patients to have
Okay.
those decisions. And then it's easier for you emotionally to know, you know what, it's okay. You go try to find another office. I dare you.
Yeah.
I dare you to
Yeah.
find it.
Well, it's amazing. I think, like you said, it can be hard, saying goodbye to a longtime patient, who decides to part ways in the wake of something like this. But, those cards that you sent out, the farewell notes, I mean, those are so important. And yet in the grand scheme of things, they take what,
Yeah.
5 minutes, 5 minutes a note. I mean, and it pays off in dividends. I mean, it's the little things, really. I think in terms of managing a big transition like this, it's really the little things that make a difference. And I think you've really hit on a lot of those, which is awesome. I'm going to venture into the unknown here, because we didn't talk about this before, but I'm just curious, because this often goes hand in hand with the transition to out of network. Did you consider offering, or are you offering currently, any kind of like membership program or anything like that for your patients?
Yes, and I highly encourage any office that wants to make this move to get that in place as soon as possible.
Yeah.
Again, part of our job in this is to educate patients as what insurance is and what it isn't. And having a membership plan gives another opportunity for a patient to make a decision that might be better for them in the long run. We just did some simple math with patients, regarding like, what are you paying in a monthly premium? Because we don't know that. We know what their maximum is. We know what their limitations are. We know what all the exclusions are, and we can educate them on that. But when we do the math and figure out what they're actually paying for that policy, and then tell them what they're actually getting, they're like, wait a minute, this is not even serving me. So the more patients you can move away from their insurance before this decision needs to be made, is the better, right? You have less
Yeah.
conversations to have when you don't have people stuck in that insurance hamster wheel. So
So were you actually offering a plan like that prior to making the transition to out of network?
we
Okay.
were, yep.
Oh, yeah, that's
We'd
really
had
nice.
yeah, we'd had our plan in place for probably 2 years before our official
Okay.
drop.
Really cool. Cool. And just for anyone who may be interested out there, just because I'm curious, do you consult with other practices as well on membership plans and that kind of thing as well?
I do. I don't help them run it by any means. I have
Yeah. Yeah. Yeah.
vendors that I'll guide them to say,
Yeah.
here are some great, businesses that run these plans for you, can get it set up for you. But it's absolutely part of
That's cool.
that process of preparing the office. If it's funny because I'll have some doctors call me and be like, I'm doing this right now. Like, let's do this. I'm like, okay.
Yeah.
And there's not maybe time for that. But if we have a little bit more time and we can work together to really line things up well, that's definitely part of it. And again, it depends on the demographics of the community. If this is the last office to go out of
Yeah.
network, then there's less that they might not need a plan as much as
Sure.
we did, for example.
Yeah, that makes sense. That makes sense. Well, this is, and again, I think that's another topic that we could just go down the rabbit hole on too for a whole nother conversation. But this has been so great, Jessica. I can't thank you enough for sharing your insights on this. I think it's definitely an aspiration of a lot of dentists out there, but it's one that is fraught with a lot of uncertainty, business uncertainty, a lot of emotional, uncertainty, I guess, and fear and anxiety. And so I think it's so important that we have conversations like these and try to distill it into, what it means, how it can be done, and that it's definitely possible if that's something that a dentist wants to see happen. So before we close out, though, I want to give you an opportunity, like for anyone listening, for a dentist owner listening right now, or even a practice manager for that matter, who has considered, transitioning their practice to out of network. What's sort of the key takeaway that you would want to leave them with here today? I mean, what's sort of the underlying message that you would want them to take away with them concerning that potential change?
Yeah, I want them to know that it's absolutely possible. It might be every practice is different and it might be a year from now. It could be 6 months from now. It could be 3 years from now, but it is possible. And I
Yeah.
do believe that this is how we are going to survive in private practice dentistry is to be able to, set our fees and get paid for what the quality work that you're doing. So I want them to know it's absolutely possible and also to have a plan, right? They don't have to work with me, but to have a plan for this, because the more intentional they can be about every detail of the process,
Yeah.
the less painful it's going to be, the more patients they'll be able to retain, the more they're going to feel confident through the process. And so, it's good for everybody. We had a dentist calling us right when we got out saying, "Oh my gosh, I can't believe you did this. Like, how's it going?" Because we've inspired hope that if we can do
Yeah.
it, they can do it. And everyone's watching, right? Everyone's watching to see how it goes.
Yeah.
And so I also, I guess, would say is don't be afraid to be brave. Don't be afraid
Yep.
to make that move. And we can do it in a way that's going to work for your practice and be smart. We'll be smart
Yeah.
about it. So, yeah.
Love it. Love it. So, Jessica, thank you again so much. What can you tell listeners about Martin Management, and where can people connect with you if they want to continue the conversation?
Yes. So I do have a website. It's martinmanagementllc.com. And you can actually book a call with me right from there if you want to talk about, I really want to do this, but I don't know what it's going to take, or is my practice ready for this, or how do I get started? Any of those things. I love to have those conversations. I can do it right from my website. I also still answer all my own emails, and it's just jessica@martinmanagementllc.com. So I would love to talk with anyone that's, looking at this down the road or next week, ideally not next week, but, ready to do this or getting ready. I think it's a great conversation to start having.
Awesome. Well, I'll put the link to the website and your email address in the show notes, and folks can connect with you there. Thank you so much, Jessica. I really look forward to hopefully chatting again sometime in the near future. I'm sure that there are many other topics that we could dig into, and it's always a pleasure having you on the show. So thank you so much for being here today. And to those listening, thank you for tuning in. And if you enjoyed what you heard, I would kindly ask that you go on to Apple Podcasts or Spotify or wherever you get your shows and leave us a rating and a review. It's super appreciated and helps us with the algorithm for sure. So thank you all so much for listening. Thank you, Jessica, and take care.
Thanks, Dan.